Good evening and welcome to today's program of On Call. Well, actually, I should say good day and welcome to today's program of On Call. Thank you so very much for joining us here in the studio at the Tobago Inspirational Network. And of course, on set with me is our resident doctor in the house, Dr. Maxwell Adeyemi. Dr. Max, welcome to today's program.
Good evening, Talisa. It's been a few weeks.
Well, no, it's not that long. Maybe about 2 weeks.
About 2 weeks, yes. How
Yes,
have you been?
I've been good, thank God. It's been a good 2 weeks.
Very good. Still maintaining your baby face.
I am. Oh, bless your heart. Oh, thank you so very much.
Something is happening to you these days. Somebody doing something nice.
We had to talk to the husband. God is good.
Understand?
All right, so we got into today's program. So today, we are looking at one of those things that you can really take for granted. One of those things that maybe I would have taken for granted in the past. But as you listen to these things, you realize sometimes how many things you overlook that could have potentially serious implications on you, your health, and so on. So today's topic, we're looking at cough. Not just cough, but the persistent kind of cough. Right, Doc?
Yep.
Dr. Max, coughing, I mean, as you say, you wouldn't really think that it's one of those things. It's just one of those things. But why do we cough? Generally, what's the purpose of coughing?
Cough really is a symptom that we complain about or that we experience, okay? And it's really a reflex kind of response that the body uses as a protective mechanism, basically, in situations where the lung perceives a foreign body. Okay, so something that is alien to the lung comes in or develops in there, the body sense of a reflex reaction. That's what they call cough reflex, to try to eliminate that. Because what is naturally supposed to be in the lung really is air, oxygen, carbon dioxide. Okay, we breathe in oxygen and the body processes and then eliminates carbon dioxide. So anything other than air that gets itself into the lung space becomes a foreign body. And the body, in its quest to, eliminate that, triggers a cough reflex that is mediated through some nerves. And therefore, the reaction will be to cough to try to get things out. For example, you're drinking water hurriedly, and the water seems to, instead of going into the esophagus, into the stomach, some splash into the lung, which is a windpipe. That is perceived as a foreign body. The body, perceives that as a threat, and therefore it brings the cough reflex automatically. Well, you have to stop drinking.
I don't know if it's because we're talking about cough, but I feel like I want to
cough now.
I just feel like I want to cough. All right, but usually when that happens, people would just say that, oh, the water went down the wrong hole.
Well, it went into the wrong place. Instead of going down into the esophagus, it gone into the windpipe, because both tubes are lying one behind the other, and this happens.
Right, but there's some, as you say, it could be because of a cough is a side effect.
Right. So the scenario I just gave there is just a normal routine thing that happens to all of us anytime, just typically layman try to understand that. However, there are situations and circumstances and diseases or illnesses that could create a condition of foreign body within the lung system, the respiratory system, and therefore the body will have to now go also into that kind of mode to say, okay, look, there's a threat, there's a foreign body, be it air particles or blood or liquid, whatever it is, the body goes into that mode, triggers the cough reflex, and then you start to cough.
Right, but we can also narrow it down to some diseases, if you want to write, that could
good. So there
also
are
have
diseases.
this as a symptom.
Right.
Right. So what are some of the things that we're looking at when
So some of the diseases or the medical situations that could lead to coughing, because we all cough from time to time for different reasons and stuff like that. And majority of the cough, are actually non-life-threatening situations, and usually when you get treatment, they will go within a week or so. Some may linger for about 2 or 3 weeks, especially if you have a viral illness. You treat it, and after a while you got treated, the cough still persists for a while, maybe for another 1 or 2 weeks, and then it will go maximum about 18 to 21 days. Most of the cough will subside. But there are situations that, we possibly do not associate with, cough that will give rise to coughing. For example, reflux diseases, okay?
I would not have associated that with a cough.
Right.
I mean, maybe belly pain, maybe,
Right.
burst,
Right. Okay.
gas, that kind of thing,
Right.
but...
So what will happen then is that if you have what we call acid reflux, okay, depending on the posture that you maintain, actually if you lie down, you bend down or whatever, the acid regurgitates into your chest cavity. And some people may actually feel it in their mouth as a sour acid kind of tasting, okay? Now in the process of that movement of regurgitation, some of the acid or the stomach content may splash into the windpipe and go down into the lungs, and that could
So it actually comes all the way back up there?
Right, that's what they call it, refluxes, because it reflux through the pipe and through the guts and gets into the pipe, and then you could have some splashing into the airway, and that would trigger a cough. So that could happen. And usually once we treat with some antacid and other things that we use to treat reflux diseases and stuff like that, most of the time the cough will subside.
So some of that acid actually goes into your lung?
It could splash into the lung.
Right.
In some situations, actually, in some people I have seen, that will even trigger spasm of the windpipes of the respiratory airway, and some of them may behave like they have some kind of panic attack or even asthma attacks. It could happen that way. So because the acid is foreign to the respiratory system, so it triggers the smooth muscles of the windpipes start to contract, and you have this kind of asthma type, feeling or reaction.
I would have never thought that acid reflux could have done something like that.
It does, it could.
Wow. What about sinusitis? I don't know if it's just me, if it's because we're a little bit more sensitive and aware, but to me it seems like almost everybody and their cousin, for want of a better expression, suddenly has, what you call it, sinus. Right? And sinusitis, as I say, could also be a potential cause of coughing. How does that work?
What happens in sinusitis is that some people may have what they call associated postnasal drips.
Yes, I've heard of that.
In which you just have this funny tasting like stuff, dripping at the back of your throat, and some will swallow it, and some get into the windpipe and things like that, and that would trigger a cough. Okay. Also, we also have to know that sinus in most instances is a result of certain type of allergies and sensitivity to certain items. And in that case, you could have families who have what we generally call atopy, ATOPY, which is really a broad spectrum of sensitivity to different things, and they are manifested in different forms and fashions in families. So some may have asthma, some may have a very persistent cough, which will come down later as a form of asthma itself. We call it a cough persistent asthma. And you could also have sinus, you could have eczema, you could have rhinitis, you could have sensitivity to drug or substances or medications or food. All these components constitute what we call atopy, all right? And therefore, the person with asthma, with sinus, may have this component as part of their manifestation, and then they also have persistent coughing in addition to the postnasal drips.
So acid reflux can cause you to cough. sinusitis as a result of allergies
Yeah.
can cause you to start coughing.
Because the postnasal drip actually tend to cause, like I told you before, a spasmodic coughing, and triggers this kind of, spasm of the airways, and then you can have.
I think that's kind of almost like what I think I had seen you a little while ago for something similar to that with the coughing, the persistent coughing that leads to like a shortness of breath kind of thing.
And you realize when we treat them with antihistamine and sinus medication, they subside after a while. It's gone.
Look at that. Allergies can do that. And this is the next one that I did not know of either, Dr. Max. Pressure medication. How does pressure medication cause one to cough?
Right. There are a class of medication, because medications for blood pressure are in different classes. Okay, you have things like called the calcium channel blocker, you have angiotensin receptor blockers, you have diuretics, you have different from about like 8 different classes of pressure medications. So this particular type, we call them the ACE inhibitors, called angiotensin converting enzyme inhibitors. Okay, and you also have the angiotensin receptor blockers, ARB. Now, the first group, which is the angiotensin converting enzyme or ACE inhibitors, you hear names like enalapril and lisinopril and captopril, perindopril and acopril and the rest of them. Those ones are called ACE inhibitors. They normally act basically around the kidney, but they trigger a chemical. Okay, the bradykinin system within the I don't want to go into too much details.
Right, because you can not only lose me, but I'm sure you lose some of our viewers.
Right, they trigger some chemicals in the way they act. Some chemicals are either blocked or accelerated, and one of those chemicals that are activated during the mode of activity in the body system will trigger a cough. And therefore, most of the persons who take this medication called ACE inhibitors, the enalapril and the lisinopril, which are the common ones, they tend to have this nagging cough, especially in the evening times, a dry, annoying kind of coughing. Okay. Now, the second category of medication works similar, and they also work through the kidney system. And those are the angiotensin receptor blockers, or ARB. They don't usually cause cough in the severity to which the first group caused, but some of them could also cause that. This one would involve things like losartan, temisartan, and valsartan, and the rest of them, So those are the two categories of blood pressure medications that we tend to trigger coughing. So when medications are given to patients, we try to at least advise them to say, look, this may happen. Usually within a week or two, if it happens, some of them might wear off. But if it becomes persistent and annoying and disturbing, then we may need to look for another class of drug.
Take them off of that. Okay, because I was about to ask you.
But those drugs are very good in terms of they are, apart from bringing down the blood pressure, they also protect the kidney. So that's why they tend to be a little more popular.
Yes. Okay, understood. All right, we're going to go for a quick break, and then we're going to come right back. So stay tuned. We're dealing with persistent cough today. We'll be right back.
Hi, everybody. This is Minister Tricia Sobers. What are you doing at 8:30 p.m. on a Sunday evening? Well, this is an invitation for you to join us once again on the program God's Point of View, where we share our opinions, our thoughts, our feelings on topical issues and also difficult issues that are contained in the Word of God. We do say, however, that at the end of the day, it's God's point of view that is the final arbiter for us as believers. So join us here on Tobago Inspirational Network, Channel 137, Realizing Purpose, Fulfilling Destiny.
And we are back with today's program of On Call. Thank you for staying tuned. And for those of you who may have just joined us, we are dealing with cough, but not just the ordinary cough. We're looking at the persistent cough. And we learned before we went to the break that, you know, there are some ailments, some medical conditions that can cause you to cough. And some of them, they were a bit new to me. For instance, the acid reflux and even pressure medicine. You know, because of how it works, as in the inhibitors and the receptors, how it works and you know, can potentially go. But I was asking you, Doc, while we were on break, if apart from it being just coughing, if the coughing, the persistent coughing, if it can lead to some other medical condition developing.
No, not really, because they are non-productive cough. It's just a dry, nagging cough that is very uncomfortable and could be distressing to some people, okay, because sometimes that disturbs your sleep. You go out and maybe you're making a speech and you're just coughing all the time, and some people are just uncomfortable with that.
I know we kind of tend to have a little, if you see somebody coughing a whole lot and you don't know why they're coughing, immediately you kind of, you want to pull away because you figure, okay, I don't know what kind of germs they may have and spreading, so let me keep to myself.
That will happen.
Kind of.
Yeah.
All right, well, we looked at when we were dealing with the sinusitis, we kind of touched a little bit on asthma and allergies and how that relates. But I know this one, I know for, well, not exactly in this magnitude, but lung, any issue that involves your lung can cause you to cough.
Right.
So tell me some of those.
Well, we're talking of the major big problem that, you know, people are scared about is the lung cancer, okay? Usually when you are coughing persistently for a long period of time and it tends to now involve you coughing blood and having shortness of breath, then that is a serious issue that needs to be, you know, looked into.
But as we said, persistent cough in itself would not cause you to cough of blood.
No, it shouldn't really.
Okay.
Right? So depending on what is causing it. But when you have to have things like tuberculosis or lung cancer, those are the conditions where you may actually cough out blood. Okay, it's some form of pneumonia as well because they are lung inflammations. Okay, so lung cancer, especially with history of smoking. However, that does not mean that it doesn't happen in non-smokers, okay, because we've seen lung cancers in people who don't smoke. Okay, so if you're having a history of smoking, obviously that increases your risk. So coughing, weight loss, okay, those are things that will, you know, point you to the direction of a lung cancer. However, you may not necessarily also have a lung cancer, but a cancer from another organ that actually spread into the lungs.
Can cause that.
And this could also cause problems, because I've seen people with prostate cancer spreading into the lung, ovarian cancers spreading into the lungs and stuff like that, breast cancer spreading into the lungs, you know. So when you have people with history of other forms of cancer, and they suddenly start to have shortness of breath and they're coughing, then you need to think some kind of lung spread, or what you call metastasis.
Right.
Yeah.
Infections, Doc, what?
Yeah, different form of infection may lead to coughing, okay? The commonest that we are all accustomed to, all the viruses around the area, okay? We have the respiratory syncytial viruses, you have just the common cold, the influenza, and all the different, viruses that we get. Those don't lead to persistent long-term coughing, but they come, take their cycle, which may be a little 3 to 5 days, a couple of weeks, and stuff like that, and it will go. However, there are other forms of infections, bacterial infections like tuberculosis and some streptococcus bacteria that may cause pneumonia and other serious lung infections. And those may eventually, you know, lead to a lot of prolonged coughing. And obviously, when you have that, you really need to take a look at it very closely.
So what we're saying is what we said, you know, we have just a few more to go through what has been the recurrent theme of On Call. Something is troubling you that is not usual for you. It's not normal. Check a doctor.
Right.
Go visit your healthcare professional. So this is happening. So you may have a cold, or you may just have, you know, come off of the viral infection kind of way. But you realize you have a persistent, annoying kind of dry or hacking cough, or right. So, and it's not going away. Get it checked out.
You need to get it checked out, okay? And cough can be either what they call a dry cough, or it could be what they call a productive wet cough, where you cough and you're coughing things out, so maybe brown, yellow, green, whatever. When you start to get to that thing, that is almost certain that there's an infective process going on, and you need to get that checked out immediately. When you cough and you're coughing blood, bad business, so you really need to check that out. Okay, another thing that we didn't mention earlier that tends to also cause persistent coughing is when people have heart failure. They have hypertension, and they have diabetes, or they have other kind of disease, situations that affect the performance of the heart. And the heart, tend to, go into failure, okay? In situations like that, sorry, what will happen then is that the heart is not able to pump effectively as it is, so there's a backlog. Okay, and then you see people like that, their feet is swollen, they look puffy, and they look, a lot of fluid retention taking place. And they tend to have more cough, especially when they lie down or in the night time, okay, they start to gasp for air and stuff like that. What will happen then is that when you are in the upright position, because of gravity, all the fluid gets to the bottom of the lungs, so you really don't have much of a problem because you still have enough ventilation and aeration into the lung. But when you lie down and gravity is eliminated, all the fluid goes on the same level, and then the fluid will now flood into the lungs, and whenever the fluid floods into the lung, automatically it will displace the air, and then you start having shortness of breath. And that is why some of them, you see, let them sit at an angle 45 or sleep at an angle 45, raise the head of the bed, and then you put the lung at a slightly inclined, almost like an upright position, and then that will seem to relieve the problem. So you could also have persistent coughing like that as a result of heart failure.
You can tell me whether this is true or not, Doctor. Maybe not everything we read on the internet is necessarily true. But I remembered reading once. It says if you think you might be having a heart attack, while you wait for the paramedics, start coughing. So the coughing is supposed to help
the ventilation and the circulation. Because when you cough, obviously, you open the airway, and then you tend to cause a lot of dilatation of some of the airways and the blood vessels, and then obviously, because heart attack is as a result of blood supply and circulation compromise, so you try to improve that.
So that one wasn't incorrect.
Yeah, it does help.
Right, just making sure, it's not nice you had to check the stuff you read just to make sure you're on the right track. Well, Doc, I know this for sure. Smoking, we've seen numerous ad campaigns and stuff.
That is
how
a major
smoking,
problem, because most people who are smokers will always have this kind of cough.
Yes, they call it the smoker's cough.
The smoker's cough, right. So it's always there, because whatever you're smoking, really, the soot and the other chemicals that comes with the cigarette obviously will find their way into the respiratory system, and obviously they will be seen as foreign body, and therefore trigger a cough reflex. So they tend to have this persistent kind of cough, and it's not a outright, a bout of coughing like that, but it's just there, and you always can pick up a smoker from the coughing, okay, or even from their teeth or from their fingers,
or the lips.
On their lips, most time you can pick them up, and once you're coughing like that, the first thing you look at their teeth, look at their lips, look at their fingers, okay, this is a smoker, and then but coughing in smoker is a well-established kind of occurrence.
Well, Doc, that kind of sounds a little discriminatory, You look at the person, teeth, the finger, the lips, and you can...
Well, fortunately, as a medical person, one of the first things that you are taught in medical school is that you evaluate somebody within the first minute of you seeing them. So you look at the person, you come in contact from head to toe, you don't size them up already, and you know, okay, you know all that may be wrong, to some extent. I used to have a teacher in those days who tell, when a patient walks through the door, a quarter of your diagnosis should be actually in your head already.
Really?
Yeah. You should have enough information, at least 25% of your information. How they walking, their countenance, how they talking, how they moving. You should have an idea of what may be wrong. It may not always work in all situations, but when you see somebody, for example, coming through your door and grimacing, you know, biting their teeth, walking, you know this person is in pain. You know, sometimes you may be able to actually evaluate where in their body they have in pain. Okay?
Because if you see them step, and every time they step, then they miscome, then you figure.
So when they walk in through the door there, that is when your assessment starts.
Right.
And you start to walk your mind towards what possible diagnosis. When they talk to you now, you get a history to take in. Then you get another 25%. And then by the time you say, okay, wait, you examine them now, you get another 25%. If you need some blood tests done again, maybe you complete your other 25%, and then you have a diagnosis.
Right. Okay, so you discriminate for a good reason.
Yeah.
Put
I
it
won't
that
call
way.
it discrimination, call it observation.
Okay, doc. Medical term, observation. We get it right.
Yeah.
Bronchitis.
Yeah, bronchitis is also in the form of, you know, the family of asthma, basically, because it's this kind of hacking episodic cough that sounds like if you're wheezing kind of way, okay? So most of the time it may be associated with shortness of breath, occasionally it may not be. And usually it's associated with the restrictive kind of lung disease called chronic obstructive airway disease. For people who have been long-term smokers, okay, over time the lung, you know, ability to expand, you know, is limited, okay, because with each spark of cigarette that you smoke, with each passing day, each passing month that you are, you know, smoking, obviously you damage what they call the lung parenchyma, okay, and therefore the lung is supposed to be able to expand like a balloon. Over time, you limit that capacity to expand, so it becomes restrictive over time, okay, and that eventually leads to what they call the chronic obstructive airway disease, or COPD, okay, so it is in the like of that, and people like that also cough very persistently. Some of them actually have asthma type kind of, you know, attacks, and they have to be, you know, in the hospital.
That's simply because you're not getting enough air into the lung, and the lung is not able to expand
to its full capacity. So that is a major problem as well.
That's a lot to take in, Dr. Max.
Yes, quite
That's a
lot.
lot to take in. So, as again, if you're coughing blood, you're coughing for a prolonged period of time, it's persistent, it's keeping you from sleeping, those are all excellent reasons to go visit your healthcare profession, to make sure that it's nothing that is any
serious.
Exactly. So you can start by a process of elimination. All right. If it's something viral, then it means that some easy medication, and that goes away, and you are good to go after then. All right. Dr. Max, thank you so very much for your time. Is there anything else that you would like to add? Anything that we haven't touched on? Anything that you figure viewers out there just need to know before we finish?
Well, just in the line of what you're saying, okay, you've got a persistent cough that is going beyond, you know, the estimated time that we expect most cough to go away, 1 to 3 weeks. If it's beyond that, or it's associated with any other symptom like coughing or blood, chest pain, fever, and all those kind of stuff, you will need to see your
tightness of your chest or anything
you need
like
to
that.
see your healthcare provider, check things out, and be sure that things are okay.
Right. Thank you very much, Dr. Max, for your time as usual. And viewers, thank you for tuning into today's program of On Call. Of course, we'll see you again next week, same time, same place. Be blessed. And if you have any questions, or if there's anything you'd like us to discuss, please feel free to email tobagoinspirational@gmail.com or call us on 297-6602. Have a great evening. Bye for now.
This program comes to you compliments of the Tobago Inspirational Network. To support this and other programs, we encourage you to give to TIN. Contributions can be made at any First Citizens Bank at account number 203-4679. We thank you for your support.